right now. So you have it, my friend.
Okay, Dr. Bond, thank you so very much for hosting this special event with us today. For those who don't know me, my name is Dr. Stroman. I am out of Atlanta, Georgia, and we are on a very serious crusade that I'll share a minute or two with all of you. We do these classes every Saturday. This is not a business opportunity platform. It's strictly education and empowerment. For those who want to be empowered, those who want to elevate your education, this is what this platform is all about. It is all about you. So I want to welcome all you beautiful people from the north, the south, east, and west. We got people coming from all over the nation, which is a wonderful thing. And so let me give you the outline of what we're going to talk about this meeting today. The first thing, I want you to understand a little bit about our nationwide and international crusade. We started this crusade several years ago. And the purpose and the foundation of the crusade is to put together what I call financial gladiators and health gladiators that love people, that have a passion for their gift that God blessed them with, so they can use their gift to raise the standard of living for people all over the country and around the world. So we have been connecting with medical doctors, holistic doctors. We have connected with financial experts from all over the country. And the beauty of this program is a voluntary army. That's the beauty of it, okay? So my job is to collect all these wonderful people and give them a platform to be a walking blessing to people and to the nations around the world. That's the short version. Now, the main focus is to help people to do two main things. One, master your health. Number two, master finances so you can have financial power. That's the short version. Look around the world, the elephant in the room. What is it? Health crisis, financial crisis. So we need a brand new playbook. We can't go by the same playbook that we had in the past. We need a brand new playbook. That's why I thank God every day that He sends wonderful people all over the country to be a part of this movement. Okay? Now, so basically, the thing that I try to impart upon people is this: diligence in management is the driving force of achievement. Diligence, and listen to that statement, diligence and management is the driving force of achievement. We're focusing on the two main things, which is mastering your health and mastering your finances. But in order to make that happen, it requires diligence and management, which is the driving force of achievement. Okay? Now, my message has always been the same. Prevention is priceless, it's less painful, and less expensive. Let me say that one more time. Preventing disease is priceless, it's less painful, and less expensive. Now, I'm going to give you some things that most of you are familiar with. So this is just a reminder of what we need to do to master and to live this life we want to live, called the abundant life. Okay? So the first thing I want to talk about is the system. I want to talk about the system, but before I even get to that, the key to freedom is knowledge. The key to freedom when it comes to health and finances is knowledge. And let me add something to that. Knowledge that's implemented, because many people get knowledge, but they don't implement the knowledge that they receive. So the key to freedom is to implement the knowledge that you receive. We're going to be here every Saturday at 4 p.m. for all of you that want to tune in. Because again, this is not a business opportunity platform. It is an education and empowerment platform. Okay, we've already had medical doctors on this platform, financial planners, and we're going to continue to do that because we need good news. Okay, we need good news. Now, with that being said, the first thing I want to talk about, and I'm going to take my time and develop this. I'm not going to keep you long, but I'm going to take my time. So we understand the crusade of mastering health and finances. The first thing you got to master before we even get to that is headquarters, because nothing changes until your mind changes, folks. Information does not bring transformation, conversion does. You can hear, and you know what the word says, faith come by hearing, but results come by doing. You can hear good stuff all day long. You don't want to be a professional hearer. And that's what happens with many people while they're stuck in their lives. They become stuck because they're professional hearers, but they're amateurs at doing. I believe my prayer for all of you, you're going to be the exception to the rule. You're going to be a person of diligence and you will take action. That's the only way if you're going to live a high level to raise your standard in your life. It's all about action. So there's something I brought to America called lip aerobics. Just talking about it, it's not going to get it. You got to go into action. Now, so I'm going to break this thing down. I'm going to tell you what we're going to cover today. The first thing is I'm going to talk about the health system briefly, because you got to understand the system. If you want to have victory over anything, you got to understand the system. So I'm going to talk about the health system just for a minute. The second thing we're going to talk about is the things that cause cancer. Now, this is Breast Cancer Month. We're going to talk about the things that can cause cancer. This is not everything. I'm just going to highlight some things that make you conscious so you can protect yourself. The third thing we're going to talk about, some ideas to prevent cancer. Okay, some things that you can do to prevent cancer. And the last piece is the relationship between finances and health, and more particular, financial planning. Because the doctors that I talk to, 90% of the doctor visits are stressed because of finances. So that's what we got to cover in a short period of time today. So that's our agenda. So let me get started. Let me get rolling talking about the system. Now, I studied nutrition for a long time. I'm a certified hydration specialist. I've been in different nutritional programs for many, many years. This has been my passion. And when I got involved with this passion, I wanted to understand the system. That's very important. And I found out that there's a lot of components now, and there's some good things now, but there's some demonic things in the system, both systems, in the health system and in the financial system. If I had time to tell you behind the scenes, what happens behind the scenes, some of you would be shocked. My job is to equip you and equip your family to get you strong, to protect, to put a shield of protection around you by understanding how the system works. Again, because of a lack of time, I won't be able to develop all of it. But many seminars that I've done in companies and organizations and churches, I've used this DVD, if you can see it. It's called Escape Fire, the Fight to Rescue American Healthcare System. And I think we can all agree that the system is broken. I think we can agree with that. So let me mention a few things about our system if you don't know it. We have what we call a disease management system. It's not a resolution system, it's a disease management system. The system that we have is a profit-driven system. It's not a results-driven system. They put profit before people. That's just the way the system is. America is the number one in medication, and we also number one as far as cancer is concerned. There's a reason for that. Let me kind of share something with you about that. People in Japan don't have the chronic disease that we have in America. When they come to America and they pick up the SAD diet, the standard American diet, we call it the SAD diet because it makes you sad. When they pick up that diet, they begin to get the same cancers, high blood pressure, type 2 diabetes, etc. Folks, that's called a clue, okay? So this is a disease management system. Other countries has a resolution system. Now, medical schools, I was going to go to medical school. I discovered that most medical doctors, they have been trained and conditioned and programmed to put your name on a pill for every ill. That's just the way the system is. Many medical doctors get less than 30 minutes of nutrition. Many of them, even though they are brilliant people and we respect them and we need the doctors, many of them don't know about nutrition. It is amazing to me. They don't know about nutrition because in medical school, they don't teach And why is that? Let me take you behind the scenes a little bit. The pharmaceutical companies fund many of the medical schools. I'm taking you back about the system. We're talking about the system so you understand. They fund many of the medical schools. So now, they control many of the media outlets, what's happening, what they're feeding you, okay? This thing is real deep and we can really get into it another day, but it's real deep. So the medical schools fund, the pharmaceutical companies fund the medical schools so you know what they're gonna listen to. Follow the money. Now, here is a book, Confession of an RX Drug Pusher. These are some whistleblowers. They go behind the scenes. This was somebody, I think she was in pharmaceutical sales for maybe 13, 14 years, and she revealed the system. So here's what happens. When they make a drug, they know that this drug is gonna have 5 or 6 different side effects, but they already know because of that, they have another 5 or 6 drugs ready for the side effects that they know the first drug is gonna do, so they can make more money off that. This is the way the system is set up. They already know this. They also understand that if this drug doesn't work as well, by the time we find out about it, they've made billions of dollars. And so they have an account set up. If there's a legal issue, they can spend 5 million. That's a drop in the bucket. This is the way the system is. So to fight this system, I'm not a politician. So I'm not going picketing and lobbying and the policymakers and all of that. That's somebody else's battle. The lobbies are so powerful. But what we can do is control your own household, okay? That's why we're doing this class today. So I wanna just help you, let you know how diabolical the system really is, okay? They want you to be on medication. Now, there's a place for medication, don't get me wrong. We're not telling you to stop taking the medication, that's not my message. But we have known people since I've been doing this crusade around the nation that people have come off 5, 10, 15, even 27 medications. Okay, but they want you to believe that you got to take this drug for the rest of your life. Now, use wisdom. If you take a medication, follow your doctor's instructions. But I'm telling you right now, we do a call every Tuesday. You should hear the testimonies of people coming off medication. Okay, now, so that's one. The other industry is the food industry. They're one of the biggest lobbyists. They know that a lot of the food is killing us. They know this, but it's a profit-driven system. So they got food scientists to put things in the food to make it addictive, knowing it can cause diabetes, cancer, heart disease, except they know this. And then they pay the doctors, and some of the doctors become whistleblowers saying they knew it, but they don't care. It's a profit driven. There's many things in America that we eat and drink, like diet sodas, for example. It's not even allowed in other countries. I mean, on their cereal boxes, they got warnings in other countries. This stuff is something else, guys. So anyway, I'm just talking about the system right now. So we understand it's a profit-driven system. The two of the biggest ones that you got to be mindful of is the food industry and the pharmaceutical industry. They are powerful and they control so much. And you'd be shocked. I think it was one of those organizations, was it the Diabetes Association, whatever, and you go to their website and they're recommending sugary cereals. Oh my God, guys, it's a lot to this. Anyway, let me move on. So the food industry is big, okay? So the history of medicine, if you really study it, the Rockefellers and Carnegie, they put this thing together to control medicine. That's why naturopathic doctors years ago had a challenge because they were trying to shut those schools down because they wanted to control medicine. Who controls your mind controls you. And that's why knowledge is freedom. Now, let's get back to this cancer deal. So I'm going to be very transparent with you. One of the reasons why I am so passionate about this topic because I have my personal testimony that I want to share with you, an experience rather. And that's why I teach everywhere I go, teach prevention is priceless, is less expensive, less painful. Prevention is priceless. If you don't take anything away from my message today, prevention is priceless. We have a mentality, I got to wait till something happens, then I push a panic button. I'm trying to help you to reverse that thinking because it's destructive. Prevention, I have a prevention mentality. I take things in my body, even supplements, not that I have those issues, it's because I don't want to have them. I feel 30 years younger than the average person at my age. Middle age to me is 80 years old. I don't go by CDC numbers. I don't go by the world system numbers. Okay? So I feel 30 years younger. I'm no better than anybody on this platform. I made a decision to be healthy. The Bible says a choice in Deuteronomy. That's all it is. And I feel good 7 days a week. And I want that our crusade is to help millions of people to feel that way, to help you to master those two areas, health and finance. Now, let me move on. So let me tell you my personal testimony why I'm so passionate about this health crusade. 20 years ago, I was married. And I know this is Breast Cancer Month in honor of my wife from 20 years ago. Beautiful wife, inside and out. I was married, newlywed. She got breast cancer. I didn't go a whole year before she made a transition to heaven. You can imagine how devastating that was to me, okay? And this is when I do what I do, this is the reason what fuels me, because I want to help as many women not to go through that. Then 4 years ago, another beautiful wife, inside and out, cancer. So I'm using my energy and my platform to try to protect as many women and people as possible. And because I learned a lot through that experience. And I learned even in the cancer situation, oh my God. It's mind-boggling to me how a lot of oncologists don't even tell them about sugar. It's mind-boggling to me that they have sugar dishes and candy and they're giving people with cancer Ensure that's full of sugar and chemicals. It's mind-boggling to me. Here's a study that came out. And guys, I'm not telling you what to do. I'm just giving you information. They surveyed oncologists and they said, if you or a family member got cancer, would you follow the normal procedures? The three, we have three main things when it comes to cancer. We got radiation, surgery, and chemo. Guys, I'm not giving you advice. I'm just putting information out and sharing with you. But what was shocking to me, the oncologist said if they got cancer, they would not go through the normal model that we have. Something to think about. Again, I'm not telling you what to do. I'm not diagnosing, treating, I'm not doing any of that. I'm telling you facts. This is a survey by what they said, but something to think about. Okay, now, so the next thing, I'm going to talk briefly about the things that can cause cancer. Folks, the old model is the old model. Folks, and one thing about having your finances and having financial power, when somebody has cancer, normally we're exposed to the normal stuff of treatment, okay? But a lot of these folks that got big money, they don't go that. Listen, there's so many things out there to fight to beat cancer. They go a different route, but they got the money to do that. It's not covered by insurance. That's for a story for another time. So let's talk about the things that can cause cancer. And all of you, we have two young ladies on the platform that are cancer survivors, and I'm glad they're here with us to let you know this is all about victory for all of you, to know somebody, because all of us have been touched directly or indirectly with somebody with cancer. And they're predicting that this could be #1 in around the world. And guess what? The latest report that I saw, over 70% of cancer is a result of the foods that we put in our body. I'm going to address that in a minute. One of the latest surveys, food is causing a lot of the cancer. So let me break this down. So we're going to give you the good news after we talk about the things that can cause cancer, because I want to protect you. My goal is to help you to live a long life with vitality, energy, not to exist, but live the abundant life. You need your health to get that done. So here we go. And again, this is going to be a refresher for many of you that's listening to me, but I want to remind you, okay, about these things. And I have a friend, I'm going to have her come in here in about a minute or two, a friend named Sylvia to say, because she's been a nurse for over 30 something years. So here's the foods, real quick. These are the things that can cause cancer. I've already talked about the food, in particular, fast food and processed food. Yes. Now, moderation is the key, guys. I'm not saying not to eat that stuff, but I'm saying moderation is the key. But fasten your seatbelt. Write this down if you want to write it down. I think drive-throughs are killing more people than drive-bys. Let that sink in. My opinion, I believe. Now again, moderation is the key. I'm not saying not to, but moderation. If you overdo it, it's a different story. I said, I believe that drive-throughs are killing more people than drive-bys. Think about that, okay? So here's the things that can cause cancer. And most of you know all of this stuff. Toxins. This is why supplementation is so very important, because that's your insurance policy, okay? That's your insurance policy, because the soils are not the same past 100 years. You're not getting the nutrients out of your soil. I don't care what your food look like on that plate, you're still not getting everything. And we cook a lot of the enzymes out of the foods anyway. So my thing is this here. That's why you got to adopt a supplement mentality as extra insurance. One of the greatest investments, not the stock market, it's you. Investing in your health is one of the greatest investments. We put so much money in stuff. But man, how about this billion-dollar temple that God has blessed us with? We just treat it like any kind of way? Let me get back on point. So here's the things that can cause cancer. Toxins, your environment, soda, especially diet soda. Aspartame, bad for you. Too much sugar. Cancer loves sugar. Low fiber, bad fats, obesity. 70% of Americans, they say right now, obesity, okay? Lack of sleep. Your immune system needs sleep, okay? Lack of exercise, bad thinking. You understand when you got bad thoughts, it can actually go into your bloodstream and affect your body. So you got to make sure your thoughts are pure and clean. That's very, very important, to make sure you got good thoughts. Unforgiveness and bitterness, that stuff is poison. That's why the word of God talks about it. Rottenness to the bone. You got to have mind management, folks. You can't let your mind drag your body down, because it will if you let it. Now, lack of sleep, exercise, poor gut health. Oh my God, this is big. Microbiome. I can spend some time on this, but let me tell you something, guys. They're finding out a lot of cancer is coming from the gut. Besides the gut, it's a second brain. Your immune system in the gut, 70% in the gut, and it can cause cancer. Guys, you got to get your gut health. See, I take me a probiotic that's phenomenal, 30,000 times more powerful than the regular ones, because I want to make sure my good and bad bacteria is in balance in my body. Gut bacteria is critical, and it can cause cancer if you got bad bacteria, if your gut health is out of whack. So I take a superior probiotics, and I eat certain foods along with that. Okay, the other thing that's important is dehydration. Now, I told you in the beginning that I went to school to become a certified hydration specialist. I'll tell you what I do to keep my body hydrated. Guys, do you understand? I wish I had time to break this down. I'm going to say it very quickly. Hydration is so critical for your overall health and your immune system, and to protect you as far as cancer is concerned. So if you don't take my word for it, here's a women's magazine. They said that over 90% are clinically dehydrated. And when you're dehydrated, your cells are dry. You don't want your cells to get dry. See, people who drink regular water, you got these big clusters, and it's not satisfying and hydrating your cells. And when that happens, you don't want your cells to be dehydrated. And when that happens, it affects your whole immune system. And when your immune system, which is your special forces, it's the Rambo of your body, it's your defense system, it's your immune system. God designed your body to heal itself. He's the manufacturer. He knows what's best for you. And he understands that if you got that immune system, oh my God. So that's one thing that I do. Here's what I do. I take this little thing, this little sachet, very simple. This company I got this from, they've been around for 27 years. This comes from near the Okinawa Island in Japan. This is not a machine, this is natural. 200 miles deep to get this. And I put it in my water, it does three things. Hydrate me at the cellular level. Hydration, mineralization, has 70 organic trace minerals, okay? It does all those things. That's why my body is hydrated. That's why you can drink 7, 8, 10 bottles of water and still be dehydrated, because you got large clusters. You're not satisfying the cells. This, my friend, and I can tell you some testimonies, and maybe you can connect with me later on. You can actually see these testimonies will blow your mind. okay, what this has done as far as hydration. Your body is 70% water. The earth is 70% water. How about that? Okay. God got it all figured out. But we have violated God's dietary plan. That's the deal. That's what happens. We have violated his natural laws. You cannot ignore natural laws because there's a price to pay. So here's another book, because I'm always reading and studying. This book talks about your body many cries for water. You're not sick, you're thirsty. Don't treat thirst with medication. You think medical doctors want water to heal their patients? No, it's not profitable. See, preventing disease is not profitable, folks. There's not a lot of money in preventing disease. They spend billions of treating. It's the after effect because they make trillions of dollars. Preventing, I know people who drank this water, diabetes, high blood pressure, all this stuff, gone. Just drinking the water. But you think they want you to know this? No. We are destroyed for a lack of knowledge. That's the whole bottom line. We're destroyed for lack of knowledge. And we got a system out here that want to keep you in the dark because they have a plan for you to keep you in the dark. They don't want you to know the stuff because they make billions and trillions of dollars of what you do not know. I hope you got the message. So make sure you keep yourself hydrated. It can cause cancer if your body, even the water you drink can cause cancer. Okay, this is why we make sure I use this. This is what I call my water insurance. I don't go nowhere. We have pastors and bishops and people from all over the country and around the world use this because it cleans up the bad stuff out of the water. And it does those three things that I mentioned. Imagine, they got the 70 organic trace minerals. You got the important minerals, folks, so let me go on. So the bottom line is these are some of the things and more, but for sake of time, that can cause cancer. Again, what is my message? Prevention is priceless, less expensive, and less painful. My message to all you wonderful people, prevention, prevention, prevention. Now, let me move on to some good stuff. I believe, my personal opinion, that the Bible is the #1 health book on the planet. And guess what it says in the beginning of the Bible? Eat vegetables and fruits. You have a live body, it requires live food. If you eat a lot of processed food, you want it with a processed body. That's just the way it is. And so if you want to feel good and live to 100, 120, whatever you want to live to, listen, it's an investment now because my definition of long-term care is taking care of yourself long-term. That's my definition. But let's talk about a few things that can help protect you from cancer. As far as foods now, remember the body is designed to heal itself. So here we go. We already know the first one, fruits and vegetables. You've been hearing that for years, but why don't you do it? Because guess what? They got you addicted to the bad stuff, the fast food and all of that stuff, right? But guys, here's what I want you to take away from my message. You're valuable. You are a masterpiece. Here's 3 things that I teach. First of all, you got to understand your value. God made you, you're a masterpiece. You're fearfully, wonderfully made. Why are you abusing this masterpiece that God gave you, which is your $1 billion temple? You got to know your value. See, when you devalue yourself, then you can do anything and you don't care because you devalue yourself. Okay, that's why a lot of times, even with crimes, and you see certain cities that this type of crime because they don't have value for human life. But beloved, you have to have value. #1, you got to be valuable. Know how important you are to yourself, your family, to God, your community. You're important. You got to get that. How important you are. You're special. You are the best that God has ever made. He's your biggest cheerleader. You are that valuable. #1. #2, you got to have some anger. Anything that's happened in the history of this country, that anything big changes happen in the world, somebody was angry. You got to be angry enough to say, you mean to tell me the pharmaceutical, the food industry is doing this to my kids and my grandkids? You got to have that indignation in me and say, you know, enough is enough. And sit down with your family, because I got a little plan that I'm going to give you in a second here. Not on my watch. Because the kids don't know any better. They'll eat McDonald's and pizza 7 days a week if you let them. They don't know. Okay? So again, let me go through this very quick, and then I'm going to bring in my friend, let us say 1 or 2 words. Here we go. So fruits and vegetables, because God wants you to eat live food. I think that's a given. We know that. If you, preferably, I want you to get organic, or if you don't, make sure you clean it, soak it really good. Okay? Fats, The good fats. Fats are good. Nuts, found out that as far as men, you women out there that got husbands, recent report said 2 hands of nuts, 2 different hands of different type of nuts can reduce prostate cancer by 50%. So nuts, these are God's foods, guys. Because you understand when you look at God's foods, there's no label. You ain't got to read. You need a PhD to read the stuff behind this stuff they got on these packages. Okay? So you got fruits and vegetables, you got good fats, the nuts and the good fats, avocados, things like that. Hydration, I've already talked about that. If you want to protect yourself from cancer, hydration is critical. Okay? And oxygen, guys, you got to have oxygen. Cancer cannot stand oxygen. You got to exercise. Outstanding, protect you from cancer. Exercising. Now, I'm going to get into stress in a minute, but stress management is critical. We're living in the times, if you allow it to stress you out with the news and all the stuff about the COVID and all of that stuff, man, guys, that stuff will stress you out. Guys, you got to use what I call mind management. You got to manage your mind. What did I say in the beginning of this class? I said diligence and management is the driving force of achievement. You got to manage your mind. I don't look at hours of that stuff. Okay? I surround my environment with good stuff on purpose. Okay? So oxygen and stress management, you got to sleep. Guys, sleep is critical. On the business side, most of you on this platform have a business. What's your sleep number? When I say your sleep number, I'm not talking about your mattress. How much money you need so you can sleep good? Because your sleep can affect your health and affect cancer. Lack of sleep. Okay? Vitamin C. Linus Pauling, who won the Nobel Peace Prize twice, said you can trace every disease to a mineral deficiency. His thing was big on vitamin C to protect cancer, vitamin E. A big one for women with breast cancer, to deal with breast cancer or prevent breast cancer, soy. Okay? Now, those are some of the things. What I take, for an example, something called silver, which has been around for thousands of years, outstanding and within a short period of time, build up your strong immune system with something called silver. I talked about probiotics. There's something called ellagic acid. It eats up cancer cells. From the University of South Carolina, this has been documented, eat up cancer cells, natural selection, all these things build up your immune system because, guys, it is about your immune system. You've got to have a strong immune system. And another very powerful thing to prevent cancer is laughter. Folks, you got to know how to laugh and loosen up and enjoy yourself. The Bible says a merry heart doeth good like a medicine. The Bible said laughter is a continuous feast. It's medicine. Laughter, learn how to laugh, okay? Very important, okay? My friend Les Brown, you know, he had bout with the cancer. He laughed so much. We had his brother on one of my shows. Les Brown brother was on my show 2 weeks ago. Les Brown laughed so much. That was medicine to his cancer. That's why he was so successful with that physical challenge. Now, what I want to do right now very quickly is I have a dear friend from California who's a part of my dream team. You know, I tell you, I got a dream team, a health and financial dream team, people around the country. And she's been a nurse for almost 40 years. And I want her to come by and just say hello. And she want to make a comment, one or two, some of the things that I said already. And then we're going to move on and get to the last part of our conversation, our class today. Hey, Sylvia, can you come out and say a few words if you don't mind, please, ma'am? Sylvia Washington, if you're out there. You out there, Sylvia? Can't hear you. I'm going to move on. Okay.
Can you hear me now?
I can hear you now, Sylvia. Hey, welcome, Sylvia. Thank you, my friend.
All right. Well, I want to thank you for allowing me to make a comment here today. And I just want to tune in on prevention.
Hey, Sylvia.
Yes.
Sylvia, do me a favor. Are you on a microphone? Because you're chopping up a little bit, my friend.
No, I'm not.
Okay, go ahead. Go ahead, continue.
Maybe I should just hold my screen here.
Okay. Okay, Sylvia, go.
Can you hear me?
Yes, breaking up a little bit, but go ahead. We'll make out.
Okay. I'm going to talk about prevention. And of course, we know with breast cancer, early detection is so important. So I encourage women to examine their breasts monthly. This is very important because we know our bodies and we can detect any type of thing that's different in our breasts. So breast examination should be done monthly. Usually 7 to 10 days after your menstruation, you should examine your breasts. If you have any unusual pain, you should notify your doctor, and hopefully you will detect early any signs of cancer in your breast. But this should be done on a regular basis, all the time, once a month.
Excellent. Excellent, excellent, excellent recommendation. Oh my goodness. Thank you so very, very much, Sylvia. Can't wait to fly out to Oakland, California when we get back to the new normal to do that event in California with you, my friend. Thank you so much, Sylvia Washington, one of my dream team members and a dear friend. Thank you, Sylvia. Appreciate you. Okay, guys. So here's the last part I want to talk about. A couple of weeks ago, I started another campaign. And so far, let's cover what we talked about so far. The first thing we talked about was the health system, to have an understanding of the health system so you can protect your family. The second thing we talked about is things that can cause cancer. The third thing we talked about, some of the things that you can do to prevent cancer, supplementation and live food and some other things that you could do to prevent cancer. One of the biggest things that I'm getting ready to get into is this, what I call financial stress. It is no joke. It can literally kill, it's literally killing people, financial stress. So I want to help you out. So remember, our crusade is to help you to master your finances and to master your health. Your health affects your finances affect your health. There's an intersection between the two. That's why what we do across the nation and around the world is to teach people to master their health and their finances. You don't just want to have one, you want to have both. Now, so what I want to do very quickly as we get ready to get to the bottom of our class today is this. I want to talk about a thing that I came up with, God dropped in my spirit called, I call it the kitchen table campaign for health and finances for the family. Think about that, kitchen table campaign. Now, why is that? I'm encouraging thousands of families across the country to get back to the kitchen table like we used to do. It's going to be a no phone zone. Now, listen, I'm going to give you some information about this at another time. You'll have a document if you want to, because I'm doing this for families all over the country. I'm getting families together, 30, 40 people in the family. We're doing a virtual deal. I'm giving them an agenda to get the families back to the kitchen table. Okay, back to the kitchen table as a family. This is going to make sense in a minute. Now, with this campaign, we want the family to put together a health plan for the family and a financial plan for the family. No cell phones. We need kneecap to kneecap and talk and put a plan together for the family. Now, what I recommend very quickly, that you pray before you have the meeting, because these two topics can be a little whatever, and you'll understand. I'm gonna get ready to go to my last topic here in a minute. It's gonna make sense. But you talk about money and you talk about health, you need to pray first, okay? To bring the harmony of God in that deal. Number two, you have an agenda. I'm gonna give you a suggested agenda. Once you go through the agenda, then I need you to celebrate. I don't care if it's a virtual game that you gotta play, watch a movie together, whatever you have to do something fun, because the mind, when you do a meeting like this, you wanna have fun. So you look forward to the next meeting. Now, the second meeting, I'm not gonna be there because it's gonna be a private meeting with the family. Folks, we got to strengthen the family. That's why I came up with this kitchen table campaign for health and finances for the family. We got to get back to the kitchen table. Let's get the harmony back into the family. God, he created the family. The devil don't like a family united together, but that's why he dropped in my spirit the kitchen table campaign. Now watch this. Here we go. So the first part with the health, I want you to write this down. OYH, own your health. This part, the last 10, 15 minutes we're gonna spend together, I want you to write OYE, own your economy. So you have own your health and own your economy. Now, let's talk a little bit about financial planning, just a little bit. We have software, we have experts. That's why with our dream team, we can help you out with any financial topic. It doesn't matter. Taxes, it doesn't matter. But you need to have a debt elimination software. We have a software to help you with debt elimination, eliminating all your credit card debt and your mortgage. Yes, we got that. We have a program to manage your personal credit and your business credit. Actually, your business credit can be built with utility bills that you pay in your house that millions of business people don't know nothing about. You got to manage this stuff. Because remember what I said in the beginning, it's about management. You got to manage this stuff. You need to have a prosperity management system, meaning that other people call it another name. I don't call it the name, but you need to have a prosperity fund. That's what I call it. Now, what I want to talk about in the last few minutes is this, very important. And I know, oh my God, this hit me. You probably heard in the news about Chadwick Boseman. We know he passed away. Phenomenal actor, phenomenal individual. But we found out that he did not have a will. Folks, if you don't hear anything that I'm saying today, please take what I'm saying to heart. I did my own survey. I found that over 90% of people did not have a will and they did not have a living trust. I also found that many of them thought a will was enough. I'm here to give you a little bit of knowledge about this. Folks, when you look at Chadwick with no will, people like Prince, Frank Sinatra, the Aretha Franklin situation, Jimi Hendrix, Robin, I can go on and on. These folks did not have a will. Some of them didn't have a will. It blows my mind with the millions of dollars that they generate with lawyers, and they didn't have a will. Folks, this is an epidemic across the nation. I got pastors and bishops. I got people from all walks of life, 30 years in business, don't have a will. They got a family, they got a house, they got material, they got wealth, investment accounts, don't have a will. I want you to get comfortable talking about this conversation. Because unless you have a mortality pill, we all gonna leave here going to heaven. So I don't know why we tripping and don't want to talk about this. Once you get it done, just enjoy your life. It gives you peace of mind knowing that you put your stuff in order. We quote things in the Bible, Proverbs 13:22, a good man should leave in, well, you leaving bills or benefits? I'm talking to you like this because I'm amazed because it happened to me. 20-something years ago when I was married, when my wife passed away, I didn't have this stuff. So learn from my folly from 20 years ago. I didn't have this stuff. But I'm sharing with all of you, my family out there, make sure you have these documents in place. Now, what does it mean? Here we go. It's a will, and this is a part of our dream team. We have a team of attorneys that made this thing so simple and so inexpensive. We have some people on this platform. I'm proud of them because they went into action. It's a will, a living trust, a health power of attorney, and a financial power of attorney. You need those 4 things. So let me break them down very quickly, and then we're going to end this class. A will is not enough. If you have a will, you still got to go through probate. It is not enough. Your assets are frozen with a will. And it's emotional when you got to go through probate. Time consuming, expensive, could cost $10,000, $20,000, $30,000. And the strife in the family, because if it's not written, people are fighting over stuff. Mommy told me I can have the dining room set. She told me I can have the card. It's crazy. People are telling me these stories all over America because it wasn't written down. That's why I want you to have the kitchen table concept as a family to discuss this. If something happens, you get this. I got $1 million in the account. We're going to split it 4 ways. You need to have these conversations. What are we doing? This is an epidemic in our community and we need to stop it. Number 2, so the will is not enough. Let me say it again because I've talked to so many people the past couple of weeks. They thought the will was enough. It is not enough. You still got to go through probate. Number 1. Number 2, a living trust is while you're alive. You can change it any kind. And the program that we have, you can change this thing 100 times. There's no extra money. This thing is so inexpensive. Because sometimes people think about this, I got to spend a lot of money. No, it's inexpensive. You can change it throughout your whole lifetime, okay? Because you got kids, you got grandkids, you got blended families, you got people get married, people get divorced, all these things, guys, you got to talk about it. To cut down on confusion, guys, that's why the concept of the kitchen table campaign is critically important, especially in the times that we live in right now. You got to bring the family together because there's too much stuff going out there. You got to bring the family together and sit down and have these discussions. Now, a will is public. It's public. A living trust is private. When you got a living trust, you don't need to go through the court system. You can bypass the attorneys. You can skip all of that. All that money people are spending, you can skip all of that with a living trust. It is amazing the difference. Now, you also need a health power of attorney. You need a health power of attorney because you need an advocate. I've seen it. I told you about my 2 wives that made their transition because of cancer in the beginning of this conversation. You need to have an advocate. Do you want your loved one to be fed certain things knowing that it's destroying them, that can actually cause cancer? Do you want them giving your loved one that? You need to be an advocate, okay? The second, the fourth part of the component of this, what we call it the My Care plan, you need to have financial power of attorney. How many people have talked to me in the past months in the hospital? Nobody to pay their water bill, gas bill, mortgage. The mortgage company don't know in house, they come out of the hospital, house is foreclosed on. You need to have financial power of attorney. If something ever happens, if somebody's in the hospital for 2 or 3 months, somebody can conduct business for you, checking account. All of this stuff can be taken care of. Because nobody want to be laying in a hospital saying, oh my goodness, my mortgage is not paying, my water bill, gas, electric. You don't need that stress because it can hurt you from even healing, worrying about things like that. You need to have a financial power of attorney. We have something called a financial lockbox. It's in a virtual safety deposit box. You can give somebody that code, all your information. Let me end with this, a part of the financial deal here. We found out that 1/3 of all life insurance policies are never claimed. We found out that billions of dollars of portfolios never claimed because we can't find anything. Because nobody had a discussion, they didn't tell nobody where it was at. We want to do things decent and in order. That's what we want. That's why I kept using the word, we need management. What I said in the beginning of the class, diligence and management is the driving force of achievement. We need management. So I'm encouraging all of you wonderful people out there. If you haven't done it, that's okay. Don't worry about the past. Your future is more important than the past. But as of today, you can say, you know what? I'm going to call Dr. Stroman and let him get on a Zoom with my family. And guys, I'm just going to talk about the generic stuff. And then you guys have a second meeting with the private stuff, because I don't want to know about your private business. But I'm here to help families across the nation to get back to the family the way it's supposed to be. The family is the foundation of our society and our community. Okay, we have been split too many. Now, other thing too, when you sit down and plan this, you need to plan long-term care. Folks, if somebody needs long-term care, do you understand how the strategy to get around Medicaid? Do you understand how to do that? Do you understand the spin down strategy? Do you understand the 5-year strategy? That Medicare can come at you your stuff if somebody got to go to long-term care in a nursing home? If you don't strategize this thing properly? Yes, that can happen. So long-term care, it can cost $6,000 to $10,000 a month. Do you have a long-term care policy? I know I'm throwing a lot of things at you guys right now. Something to think about because I want to bring the family back together. Okay, so any of you need me to do the kitchen table campaign family meeting with you guys just to kind of talk about the ideas, let me know. We'll email you the outline, and it's not going to cost you. This is my service to all you wonderful people. I don't charge anything for this. I just want to love you and help you by putting the family back together again. Okay? So now, if you want information about putting this My Care plan together for your family, you can. I'm going to give you this website. It's financial eduservices.com, or you can text me, or whoever invited you, they might have access to this information as well, but I give you my cell number, you can text me, because this is something I'm passionate about. God dropped this in my spirit a couple of weeks back. I said, I got to do it. My cell number is 678-907-3135, 678-907-3135, okay? If you want me to help you with this, free of charge, you call me and I'll be here because I am a servant. I'm here to help you. Now, here's the word I want you take away. When I talked about the will, the living trust, the health, power of attorney, I want you to take that word, that's those 4 things, and call it this. You're leaving a love letter to your family. How about that? You're leaving a love letter to your family. Okay? I think they can digest a lot better doing it that way. So let's summarize, and we're going to close this class out today. Guys, we're here every Saturday at 4 o'clock with different topics to talk about to help empower our community. So we talked about, the first thing was what? The health system, right? We talked about escape fire, what I use in my seminars, healthcare system, oh my God. We also talked about the things that can cause cancer. So we want you to protect your $1 billion temple, okay? I told you about my personal challenge, my personal thing that I went through with my wife, had breast cancer 20 years ago, and I was a newlywed. I wasn't even married a year, and she made a transition because of breast cancer. I went through that whole experience, so I've learned a lot since then. That's why I'm passionate about this topic, okay? We also talked about the things that can prevent cancer. Folks, God designed your body to heal itself. I want you to get back to eating live food for your live body. Minimize the processed food and the fast food. I said this in the beginning, and I'll say it again. I believe that drive-thrus are killing more people than drive-bys. Minimize the dry food, the fast food, minimize it. I'm not saying not to do it, but minimize it, okay? Then you got to put superior supplements in your body because you need that extra insurance to protect your immune system and build it up. Folks, it's all about your immune system. And then the last thing, we talked about having a financial plan, and we talked about this kitchen table campaign that I'm doing across the nation. I want you to put together your financial plan. And remember, you need to make sure you have that will, living trust, power of attorney, all those documents together. So here's the challenge as we close. There's a disease, 2 diseases that we have to fight. The disease called excuse-itis. It's an excuse-itis gland that we have. We're good at making excuses. And the other disease of procrastination. And procrastination is the assassination of your financial and your health destination. I say it again. Procrastination is the assassination of your health and financial destination. There is no such thing as perfect condition. Make it happen, not just lip aerobics and talking about it. Be about it, okay? Because you're the best God has given. You're the best God has. So remember, I'll leave this with you. Leave a health and financial legacy for your family. If you need help, I got a whole team of experts in all these areas that can help you. Okay, that's what our crusade is about. So my prayer for all of you wonderful people is to live long, to live strong in your health and in your finances. I want to thank all of you wonderful people for taking time out of your beautiful Saturday to be with us. I pray that some of this information hit home with you and that you do something with it, because we say everything I said, I did it out of love because I care for each and every one of you. And I want all of you to catch something. I want you to catch a winfection, because that's who you are. You're designed, God made you to win. He doesn't make anything to fail. Catch a winfection. That's your original design, to be fruitful, to multiply, replenish, subdue, and have dominion. Have that divine frame of mind, because remember, you're not just a good idea, you are a God idea. With that being said, I want to thank my dear friend, Dr. Bond, for hosting this Zoom meeting this Saturday with us. And I want to say good evening, good night, good evening, wherever you're around the country, around the world. Thank you for joining us. This is Dr. Stroman. It's been a pleasure to spend this Saturday with you. Have a victorious day and live your life to the fullest. Have a great day, everybody.